Number 4, surprising or embarrassing symptom, your labia shrinking. Yep, your labia don't disappear, although they can get pretty darn small, but literally shrinking and becoming smaller. So when you were in puberty, you had labia minora that were very, very small, and they kind of expanded and got larger due to the surging hormones. Well, the opposite thing happens when you go through menopause. The labia start shrinking, becoming thinner, becoming paler, becoming smaller, and you look anatomically different, right? You look in the mirror, if you take a mirror down there, which I highly suggest women to do so they know what their anatomy looks like normally. It may look like the labia are actually getting smaller, or even more wrinkles, or even less plump. And that's because A, they're losing collagen, but B, with the lack of hormones, the tissue tends to shrink. And women often will think, why do I look so different? I mean, why are these changes happening? And sometimes that affects libido. If you notice that you don't look the same as you did before, it can sometimes make you self-conscious, especially with your partner, right? And so understanding that that's normal, that they tend to shrink and get smaller, is okay and acceptable. Lastly, I would say stress incontinence, urgency symptoms. So bladder symptoms. I said a little bit about the microbiome in the bladder, but basically the microbiome changes when you lose estrogen. And so because of that, you're more susceptible to infection. So women get more UTIs in menopause, even recurrent UTIs, because they don't have that nice bacterial composition to prevent UTIs. But the other thing is that they develop urgency symptoms, because the muscle also likes to have estrogen to work properly. So the muscle under the bladder that helps control when you're going to cough and then your muscle squeezes and says it's not the time to leak, that muscle becomes relaxed, and also it doesn't necessarily contract appropriately. So some women get urgency symptoms where the muscle is actually contracting and making them feel like they have to pee, even though they may not get much out. So those symptoms can be pretty embarrassing if you're like at the mall walking around and suddenly you start having leaking. So those are the 5 embarrassing symptoms that happen in menopause down there. But these are things that you can actually do something about. And I would encourage you to talk to your provider if you're experiencing any of these about what are the options specifically for you. And you don't have to live with this. You don't have to suffer. You can get options to help you.